Hello friends, today we're going to discuss about what is melasma, which are the causes of melasma, and how it can be treated. Because a lot of females are suffering with melasma, and they are taking treatment since very long time, but still it is not getting cured. So in this video, we're going to discuss about all these factors, so which are responsible for melasma. So melasma is the dark brown pigmentations on the face, generally is seen on the forehead, then cheeks and upper lip, and which is bilaterally symmetrical. Generally, the causes of melasma is hormonal fluctuation during pregnancy, which is considered to be one of the major factor for melasma. Then it sometimes it might be a genetic factor also responsible for melasma. In some cases, those ladies who are constantly come into the sun exposure, so these are also very prone cause for the melasma. So, or sometime it might be there's been some women who regularly use contraceptive pills. So, in due to that contraceptive pills, it one of the major cause for the melasma. So because there have been melanocytes in our skin, they produces melanin pigment, and due to that melanin pigment, the dark brown discoloration style supposed to happen on this face, and these all are the trigger factor for melanocyte stimulation. So in if you consider about the treatment of melasma, there have been not at cure in allopathic medical science that it could not be uh, fully curable with allopathic medicine, but still they have used some lightening agents, skin lightening agents, or what we are called anti-depigmentating topical applications, including hydroquinone, kojic acid, azelaic acid. Sometimes they also use chemical peeling, or in some cases, laser therapy also used in some cases. But what I've seen that in most of the cases, especially in India, those women in the rural area, especially those women who are taking some ointments from local pharmacy, and they are using since very long time, and which is it might be one of the combination for hydroquinone and including steroids or retinols. This hydroquinone, if it is used since a very long time, it might be very dangerous for our skin, because there has been some indications that is being given by dermatologists are very important. Because if it is you are using hydroquinone since very long time, then it must that you always follow some protocols, like you have to apply broad spectrum sunscreen lotion which have that SPF 13 or more. Then you have to cover your face if you are going to sun exposure. These are the very common factor that we have to remember if you are using uh, ointment which is based with this hydroquinone. Then even since very long time, if you are using kojic acid, it might be one of the skin irritant, I'll say. So we have to use this all this topical application according to your suggestion of your dermatologist. But it's definitely it will not cure your disease, melasma. For curing the disease, there has been a lot of homeopathic medicines available, because it considered to be disease of your hormonal system. That is, I'd say that is one of the endocrinal system problem here, and its manifestation is seen on your face. So if you have to make these disturbances into the normal state, if you want to make this equilibrium of this hormone into the normal state, then definitely homeopathy is for yours. There's been some time definitely needed to get away from this disease, but definitely there've been a lot many medicines to cure melasma from roots. Some other important thing that you have to keep remember if you are suffering with melasma. Very first, that you have to cover your face while going to the sun exposure. You have to use broad spectrum sunscreen versions. Then there's been some citrus food that you can take, which contains a lot of vitamins C and all these antioxidants that is especially needed. So these are the some common things that you have to follow. But definitely you can think of homeopathy always if you want to get free from disease from its root. So I hope this video is helpful for you. So thank you so much.